This is a pretty silly title that I say I don't do stupid pain. And the reason I talk about this is a philosophical approach to what I do and the reason why I do what I do. So there are so many stories every week. I hear patients coming through that have had lip fillers done somewhere else with just a needle being shoved into their lip, and it's like torture chamber. Totally inappropriate for me when I hear this kind of stuff. It's ridiculous. I don't hurt patients. I don't like hurting patients. My goal is never to hurt patients, but I don't do everything painlessly. So I don't really give you stupid pain. I don't give you pain that's ridiculous, that's unreasonable. They did a study, and they actually found the number one reason patients do not go back to the plastic surgeon is not because of a poor relationship, a poor outcome, complication, whatever you think is out there. It's actually pain. The number one reason people don't come back is pain. So first of all, if you've been my patient, you know that I don't hurt you. When I do Botox, you can't even feel the needles because I do a vibrational technique with my fingers it's near flawlessly painless. But there are some things that I have some pain. So, for example, when I do mesobotox with a little bit of injections near the area, it's not a bad pain. Some of my patients just say, look, I have a really good pain threshold. Could you just do, I don't have time for some numbing, which I can do an express numbing in 15 minutes. But for patients that say, look, hey, I can handle it, I just want to do it. Yeah, it's not stupid pain. It's not pain like being shoved with a needle in your lip. It is not doing a facelift under local anesthesia. It is something where there's some mild discomfort, and I encourage patients to do some numbing medicine for that. And so there's still some discomfort. It's not zero pain, but there's some mild discomfort. And so it's a very small needle. And so if someone says, look, I can handle pain, let's try it. If I say, look, we're middle of doing it, and you go, no, that's a little bit more comfortable than I want. Let's go ahead and do something to help you mitigate it. So that's easy. Hair transplant, a great examples. Other places, they just do it totally under local anesthesia. They're injecting your whole head. That's stupid pain. PRP I used to do, to me, was bordering on stupid pain. So I have a technology now that really helps mitigate stupid pain so people don't have it, which is basically doing a plant-based therapy called hair stem, which involves no needle and no pain. So I don't do stupid pain. I don't have you come in here and I torture you to death and figure, hey, that was worth it. Otherwise, you won't come back to me, and I hate it. I hate hurting people. I'm not here to hurt you. I'm not here to make your experience miserable with me. I want to make everything as painless as possible. When there is some level of discomfort, so there is no pain, minimally painful, slightly uncomfortable, and stupid pain. So I don't do stupid pain. But if there is minimal pain or mild pain, I will warn you about, I'll tell you, there's some little discomfort. Another great example is what I call dynamic fillers. So with dynamic fillers, I have to do a cross-hatching on the skin. There is a little more discomfort with that. But I tell my patients, about 80% of my patients don't do it with numbing because they actually do well with it. But some people say, look, hey, I'm not really a fan of any discomfort. I don't like needles. So I'll say, look, let's get that numbing in. I insist on it. When I hear the patient's feedback, it gives me a calibration to be able to understand how to deliver that message to them. And so, of course, in someone that has a very low threshold of pain, I would much rather you wait. In fact, I would insist on it that we're just going to give you that time to do some numbing, or maybe we'll add some Pronox to it. And a great example, another lady who's very needle phobic, I did her mesobotox, and I did it with numbing. And she said, it was still a little more comfortable than I would like. Hey, the next time I'm going to do it, I need that Pronox, a breathable nitrous gas. It blows off pretty quickly. So that's pretty rare that I need someone to give breathable nitrous gas with mesobotox. I've done it a couple times, but some people have different levels of threshold. But one thing I will not offer you is stupid pain. When you come in here, I'm not here to torture you and make things ridiculous like what you had down the street, where people have no clue how to do dental blocks, they have no clue how to treat you appropriately, and they're just torturing you. So that is not going to happen here. But there may be some discomfort, and my goal is to calibrate that level of discomfort and help guide you to make it as minimal as possible.